Hi, my name is Emily. I'm going to be your nurse today. Can you tell me your name and date of birth? Mrs. Fox? Hi, I'm Emily. I'm going to be your nurse. Alright, so I would ask if she was conscious, I would ask what her name, date of birth is. And since she isn't very high in level of consciousness, I'm going to go check her ID bracelet and make sure that it is who she is. So it is Mrs. Fox. I'm going to go ahead and do your vitals and do a head-to-toe assessment on you, and then I'm going to go ahead and insert your Foley that was ordered by the doctor and give you some IV fluids, okay? So she doesn't have an IV and no catheter as of now, but I would check the tubing of both, make sure it wasn't kinked, check her surroundings, make sure she can get up to go to the bathroom, but she is unable to do so right now, so making sure that the way is clear for sure in case if she would get up and try to walk on her own. I'm going to keep, when I leave, the bed rails up for a safety precaution. I am going to take her vitals. The vitals that I have are her blood pressure is 124/68, her heart rate is 84, respirations is 16, and she's on a ventilator, and her temperature is 98.9. I'm going to have her turn her head to the side. I'm going to check for JVD, turn it to the other side, check for JVD, no JVD there. I'm going to assess for her lung sounds. Alright, and then I'm going to do her posterior and have her sit up for me. I'm going to do 8 on the front, 10 on the back. Alright, have her sit back. Your lung sounds are clear. There is no crackles or anything like that, A&P, so that's a good sign. I'm going to check her extremities. She doesn't have any swelling, and she is warm, cool to a touch. And then I'm going to go ahead and look at her stomach. Her stomach is not distended. It's round and flat. Are you having any pain anywhere in your upper extremities? No? Okay. Is there any pain in your stomach? No? Alrighty. I'm going to go ahead and take a listen to her stomach, and then I'll palpate. Alright, bowel sounds times 4. Alright, and there is no hardness in her stomach. I'm going to, have you had a bowel movement in the last 24 hours? No? Okay, are you having any pain when you urinate? No? Alright, that's a good sign. Are you passing any gas? Yes? Okay. I'm going to go ahead and then again look at her legs and double check that she has no edema in her legs. Her legs are kind of cool to touch. She is unable to move her extremities by herself, so I would be moving them for her to make sure that she has the mobility. Okay, and her cap refill on her toes is less than 3 seconds. I would also do that to her fingers as well. And she has no open sores or anything on her. All her skin is intact. So I'm going to go ahead and start her IV of normal saline at 75 milliliters per hour. So since I don't have primary tubing, I am going to use my secondary tubing. So I'm going to need a set of gloves, primary tubing if I had it, but this is secondary, which I'll use. A flush to make sure that the IV site that she has is patent. I need a alcohol swab, and then I would have a bigger normal saline, but I have my normal saline bag here. I would make sure to check the date, time of this and make sure it's not opened, and I would label on the back the start time, the patient's name, date of birth. I would ask the patient her name, date of birth. I would ask for any allergies, and make sure she has none allergies. I would go ahead and put on my gloves. She would have a PRN adapter already hooked to her IV site. I do not have one of those, so we're going to act as if I did. First thing I'm going to do is take her IV site. I would clean the hub with an alcohol swab, and I would hook up my flush and make sure to flush it to make sure that it was patent. My next thing, I would take my primary tubing, making sure that the roller clamp is clamped shut. I would take my IV bag and would spike it. I would take this blue cap off. I would spike, make sure that it's spiked. Once it is spiked, I would unclamp. I would do this over a sink if I needed to. I would unclamp and fill this, squeeze the hub and let it fill and prime. Once it is completely primed, I would lock this back into place. I would clean my hub of my primary tubing and the hub of her saline lock again, and I would hook the primary tubing to the saline lock, hang this, and program it to 75 milliliters per hour. Let it run while I start her catheter, and making sure to come back and check on it after a little while. And then I would document that I had given her an IV of normal saline. I'd wash my hands. After that, I am going to go ahead and start her catheter. This is a sterile procedure, so I need to make sure to stay as sterile as I can. And if I mess up sterility, I would therefore restart the process. So I'm going to use the bag that the catheter comes in as my trash bag. I'm going to set this down here. I'm going to set this off to the side and open up my field. So I want to make sure I'm opening away from me first. I'll do this in front. Opening away. And then this is going to be my drape that I can use if I would like to put underneath of them or between her legs. I would open away, making sure not to touch anything in the kit and keeping a 1-inch border. I would open towards me last. Then I'm going to get my sterile gloves. Since this is a sterile procedure, I don't have any sterile gloves left, but I'll act as if these are sterile. So I'd open up my package, and I'd have already washed my hands. The first thing I'm going to do is there's going to be a lip. I'm going to put my hand underneath of the lip so that I'm not touching, and slide up in on my hands and not touching afterwards. Take this hand that is sterile and do the same. Keeping sterile, and now that my hands are sterile, I can touch inside of my field. I'm going to take this and set it to the side, keeping sure everything is on my sterile field. This would have been inside of my catheter kit, so I could touch this if I wanted. And this is just a drape to put under if I would like. I'm going to put this, making sure not to touch anything but that. And then setting this. The first thing that I'm going to do is make sure I have a flush. Making sure I have iodine packet that I'm going to put over top of the cotton swabs. I have a kit here if I need to take a sample, but I'm not taking a sample, so I'm just going to be inserting the catheter. And then I have my lube that I'm going to put the tip of my catheter in. So I'm going to take my catheter, making sure not to swing it anywhere. And I'm going to keep this all in this bucket, but I'm going to take my lube and put this in the lube, the tip, to make sure that it's easy application. I can throw this in the trash. And then I'm going to take my iodine, open it up, and put it over top of my cotton balls. Throw this in the trash. making sure to not really reach over too far of my sterile field. I want to take my flush, open it, hook it on, and inflate the balloon, making sure that the balloon is intact and it's not messed up. Once I see that it's inflating, I'm going to draw back all the solution out of it and keep my flush hooked and place it in the loop. Okay, and that's in the loop for now. It won't stay for right now. So then I'm going to take my cotton balls and make sure that her labia and everything is open. She's going to go ahead and spread open with my hands, keeping it spread. After I touched with this hand, it is now contaminated, so I'm going to always work with my left hand. And I'm going to swab downward, throw in the trash, swab downward, throw into the trash. I'm going to do outside, outside, middle, middle, and then swab down. And my last one, I'm going to take and insert into the vagina so that I know that I'm not in the vagina when I try to insert. So with this being lubricated, I would keep this hand on. I would not allow it to come off. And I would keep and I would insert and keep inserting until I see flashback of urine if I was doing a straight cath, or until I see urine flowing into the bag. Once I see that, I'm going to advance a little farther. I'm going to flush to see the balloon. Okay, once the balloon is fully intact, I'm going to take a slight tug to make sure it is all the way in, and then I'm going to pull back, make sure it's all the way in the bladder. And then once it's all the way in, keep pushing down and unrelease, and the balloon will stay intact, pulling a slight bit. Afterwards, I would keep my IV tubing, or my catheter tubing, so that it is not kinked to an immovable part of the bed, and then make sure that she's not experiencing any pain. Document the date, time, why I inserted the catheter, how the patient tolerated it, and the color of the urine and how much urine I had. I would then clean up all of my supplies, and this would be hooked to the bed as well. And then I can throw all of my supplies in the trash. I would provide any care, perineal care that needed to be done as well. And I would throw all of this in the trash, take my gloves off properly, wash my hands, and then I'm going to go ahead and talk through the study with her and answer any of the questions that she might have. So the reason that the patient was in here is because of a neuro accident that happened 2 days ago, and her level of consciousness is low. I would, at the start of my shift, to make sure to assess her ventilator, respiratory status, lung sounds, and do a full head-to-toe assessment. I would take vitals. I administered the normal saline at 75 milliliters an hour. At the time when I gave the normal saline, my assessment that was concerning, I would make sure to check for brain activity, immobility, and her breathing status, just because she is low with her level of consciousness. For the hour, I would come back hourly to check her catheter and check how much urine output she had. So for the last 3 hours each hour was 180, 240, and 440. And this is concerning. And what could be going on is she has diabetes and syphilis, and she also has a neurological damage that's causing her to have low level of consciousness and being to where she doesn't open her eyes unless she's stimulated. We are going to take some diagnostic testing, such as like a urine specific gravity, electrolytes. I would check her ADH levels. Her lab values for her sodium was 155. Her serum osmolality was 310, and her urine's specific gravity was 1.005. The reason that her urine is so low is because she is excreting so much water in her urine, and the reason that her serum osmolality was high is because the water is being pushed out through the urine, causing the blood to be concentrated. So some medications that the provider would most likely change would be giving IV fluids and changing that to D5W and an antidiuretic to help her hold on to some more of that fluid to keep her from becoming dehydrated. The orders the doctor had ordered are going to be free water flush of your OG tube every 4 hours, 200 milliliters. You're going to change the IV fluids to D5W at 125 milliliters per hour. They're going to make sure you're checking for a daily weight because you are pushing out so much water. You want to make sure that you're not losing or gaining and holding on to too much fluid if they would give you that antidiuretic. And we want to make sure to check your sodium and your serum osmolality levels just because you are pulling so much water off right now that it's going to keep getting lower and your serum osmolality is just going to keep getting higher. And then we're going to have you a tube feed pump to administer the free water and change the IV fluids from the pharmacy. So what we want to do for monitoring, we want to monitor your hourly urine output. We want to monitor your labs, your vital signs, any type of things that you are taking in. We want to make sure that we are keeping track of your INO and monitor daily weights. So I will recheck and make sure that her IV is still flowing securely, making sure that it's not infiltrating and it is still intact. I would check the IV site every time that I came back into the room to make sure that it wasn't red and that there was no swelling going on. So 2 days after we started her treatment of the IV fluids in her catheter, her urine output and specific gravity became to come back to baseline and normal, but her GCS is now between 4 and 6, and her pupils are dilated to 8 millimeters and fixed. With that, we see respiratory rates going erratic, and her intracranial pressure is 18. Her heart rate is dropping. What we see most likely with that would be some type of brain bleed or swelling causing O2 to be reduced to the brain. And her hematoma is more than likely has ruptured. Other than that, that's most of the case study. I would make sure to answer any questions that she had, give her the reasonings behind giving her the normal saline, such as keeping her hydrated because she is pushing out so much water, and making sure to keep checking back that she is still, her level of consciousness isn't going any lower, and hopefully that it's increasing and getting better. And then I would continue to monitor her vital signs as well. And then when she becomes more oriented, I would then talk to her and educate her on how to prevent this from happening, what we're going to do to continue in making her get better, any type of diet that needs to be changed any medications that the doctors order. We'll explain why she's getting those and what they're going to do for her. But other than that, she's good to go to rest, and then I will report off to the nurse.